All right, so get ready because today we're going to be doing some serious medical detective work. Our case today is coming from the practice notes of a med student, and they were examining a patient with, well, multiple chest scars, one of which suggests, get this, that the patient has had an entire lung removed.
Wow, that's pretty wild. It really makes you think about what this patient has gone through, right?
Exactly. And that's a left-sided pneumonectomy. So for our listeners out there, that means the entire lung was surgically removed. And get this, there are even more scars,
Yeah.
suggesting they had even more procedures. So what we're going to do today is use these scars as clues and try to piece together this patient's health history. So when you first look at this case, what really jumps out at you?
Well, the first thing I notice is that the student is trying to figure out what happened just from the scars and a physical exam, and that's a pretty tough challenge, to be honest. The notes mention that the patient's chest moves a lot differently on each side. The right side expands much better than the left. And when listening to the patient's chest, there are no breath sounds on the left side, but everything sounds normal on the right.
Yeah, that makes sense. If the left lung is totally gone right, I mean, the body would have to adapt, and the right lung would have to work even harder.
Yeah, it's really amazing how resilient the human body is to be able to compensate for such a huge change.
Hmm.
But this also makes you think that the initial diagnosis must have been pretty serious to require such a drastic measure.
Right, you're totally right. So let's talk about these scars specifically. On the left side, there's that huge lateral thoracotomy scar, pretty typical after a pneumonectomy. But then there's a smaller horizontal scar too. And the student notes that it's on the front of the chest, which we found a bit odd.
Hmm. That smaller scar could be from a Chamberlain procedure. It's not very common, but it's used to get to a very specific area of the chest, that space right next to the aortic arch.
Okay. And why is that area so important?
Well, there are lymph nodes in there that drain the lungs, and if those nodes are swollen, or if they show any signs of cancer, it changes the entire treatment plan.
So it could tell you whether a potential lung cancer has spread.
Exactly. The Chamberlain procedure is sometimes also used to take biopsies of any masses in that area if there's something suspicious, but it's not clear whether it's a lymph node or something else.
Oh, wow. That's fascinating. And the student also mentioned there might be a third scar on the left side near the sternal notch.
Right, that could be from a mediastinoscopy. There's another procedure used to check out those lymph nodes. It used to be much more common, but nowadays it's often replaced with less invasive techniques.
Interesting. And how about the right side? It looks like there are a bunch of smaller scars over there as well.
Yeah, those are probably from VATS, which is video-assisted thoracoscopic surgery, basically a minimally invasive technique. They make just a few tiny incisions and use a camera to guide instruments inside the chest.
Oh, cool. So VATS could be used for like a simple biopsy or something more serious?
Yeah, exactly. It could be anything from taking a tiny sample
Yeah.
to removing a bigger chunk of the lung, like with a lobectomy where they remove a whole lobe.
Okay. So we've got this pneumonectomy on the left side, maybe some exploration of the lymph nodes, and then something going on with the right lung too. So let's go back to that pneumonectomy for a second. Besides the lung cancer we've talked about, what else could lead to such a major surgery?
Well, there are a few other possibilities. One is bronchiectasis. It's basically damage to the airways that makes them widen permanently. And if it's really bad, and it's only in one lung, then a pneumonectomy might be necessary.
Okay, so we've got two scenarios, lung cancer or bronchiectasis. How can doctors tell the difference between a full pneumonectomy and removing just a lobe of the lung, like with a lobectomy? Especially since you mentioned that the remaining lung tissue can sometimes expand to fill the space.
Right. That's where a really good physical exam and some imaging, like a chest x-ray, become really important. With a lobectomy, the signs can be pretty subtle. You might see a raised diaphragm on the side they took the lobe from, but often the remaining lobe expands a lot.
So it could almost look like a totally healthy lung.
Yeah, kind of. With a pneumectomy, though, the signs are much more obvious. The whole chest cavity on that side will sound dull when you tap it, and there won't be any breath sounds. Or they might sound really different, like the main airway has moved.
Right. So in our case, those missing breath sounds and the dullness on the left side point pretty strongly towards the pneumonectomy that the student suspected. But let's go back to that lung cancer idea again. If the doctors suspected cancer, what would they normally do to check it out?
Well, they would start with some basic tests, like blood work and a chest x-ray.
Hmm.
But if they're really concerned about cancer, they would definitely order a CT scan. It gives them a much more detailed picture of the chest, and they can help figure out the size and location of any tumors. And they might also order a PT scan, which can show areas of really high metabolic activity, which is often a sign of cancer.
And how would they know for sure it's cancer and what type it is?
They would need to get a biopsy. It's basically a small tissue sample from the suspicious area. And there are a couple ways to do that. They might use a bronchoscope. It's a thin, flexible tube with a camera to go down the airway, take a sample. Or they might use a needle biopsy, guided by CT imaging, to reach the area through the chest wall.
So they need to get a piece of the puzzle to look at under a microscope, and I imagine this involves a whole team of specialists working together.
Oh, yeah, absolutely. Diagnosing and treating lung cancer is definitely a team effort. You've got surgeons, oncologists, radiologists, pathologists, nurses. They all play a vital role in making sure the patient gets the best care possible.
Wow. So many people involved. It really makes you realize just how complicated this whole process is. Speaking of treatment, what are the usual ways to treat different kinds of lung cancer?
Well, broadly speaking, lung cancer is divided into two main types, non-small cell and small cell. Non-small cell is more common. And if it's caught early enough, it's usually treated with surgery to remove the tumor. Small cell lung cancer, on the other hand, tends to be more aggressive, and it spreads much quicker. It's often treated with chemo and/or radiation therapy.
So the treatment really depends on the type of cancer they have and how far along it is, and the patient's overall health. It's really personalized medicine.
You got it. It's definitely not a one-size-fits-all approach.
Okay. So we've talked a lot about the lung cancer possibility, but we can't forget that there might be other reasons why this patient had lung surgery.
That's a good point. We talked about bronchiectasis, but there are other things too, like a lung abscess. It's a pocket of pus in the lung, or even complications from an injury.
Yeah. It just goes to show you that even when a diagnosis seems pretty clear, there could be a completely different reason behind those scars. Makes you wonder what other things the student might have found during their exam.
Yeah. I bet there are some more interesting details hidden in those notes.
Well, the notes do mention something pretty striking about that Chamberlain procedure scar, something that could totally change our view of this whole case.
Oh, now you've got me hooked.
We'll dive into that when we come back for part 2 of this deep dive.
So you were saying something about the Chamberlain procedure scar. What's so special about it?
Well, the students' notes say that this scar could be even more important than we first thought, if you remember. This procedure lets them get to that area right next to the aorta, where those key lymph nodes are.
Right. And we talked about how finding cancer in those nodes would be a big deal for the patient.
Yeah. And it seems like the student thinks this scar, along with some other things they found, points to a very specific and rare kind of lung cancer.
Interesting. Most lung cancers are either non-small cell or small cell, but there are some rarer types too.
And it seems like this patient might have one of those less common ones, which could explain why they needed both a pneumonectomy and a Chamberlain procedure, like the students putting together a puzzle, using these scars as the pieces.
Yeah, like medical detective work, using clues from the patient's body to figure out their medical history. And this is where the student's careful notes about where the scar is become so important.
Right. It's not just about seeing a scar, but about its size, shape, and where it is. So let's go back to that big lateral thoracotomy scar on the left side, the one from the pneumonectomy. What else can we learn from that?
Well, a scar like that really shows you just how invasive that procedure was. It's a major surgery. And the body has really been through a lot to heal. The notes also say that the size and location of this scar helped confirm that it was definitely a pneumonectomy and not a lobectomy where they only take out part of the lung.
But couldn't a really big lobectomy scar look like a pneumonectomy scar?
It's possible. But remember what we talked about earlier, the physical exam findings, like no breath sounds,
Yeah.
and the dullness when you tap the chest. Those really point to a pneumonectomy. And the size of the scar itself is a good clue, too. It goes pretty far, which is typical for pneumonectomy because they have to take out the whole lung and close off the bronchus. That's the main airway to the lung.
So it's like the scar itself is telling a story, revealing how big the surgery was.
Exactly. And then there are those smaller scars on the right side, probably from the VATS procedures. Remember we said the VATS can be used for a bunch of things, from biopsies to even a lobectomy?
Right. And the notes mention a scar on the right that's about 6 centimeters long, which the student thinks could be from a VATS lobectomy.
It's amazing how much surgery has advanced. Now they can take out a whole lobe through just a few small cuts. But the notes also say that those scars could be from a more traditional open lung biopsy or a wedge resection, where they take out a small wedge-shaped piece of lung tissue.
So there are a few different possibilities for those right-sided scars, each one pointing to a different thing they did to that lung. And it makes you wonder what the connection is between what they did on the right lung and that left-sided pneumonectomy.
Yeah, it's a great question. It could be that the right lung procedures were done to see if the cancer had spread, or to take care of a whole other problem. Remember, the notes mentioned other things besides cancer, like bronchiectasis, which can affect both lungs in different ways.
It's like we're detectives trying to figure out the order of events
Hmm.
and how everything is connected.
Exactly. And in this case, the scars are our best clues. Each one represents a chapter in this patient's medical history. And by looking at them carefully, we can start to understand just how complicated their case is.
Yeah, and it's not just about the physical scars, right? We talked about the emotional and psychological impact of going through major surgery.
Absolutely.
Right.
Imagine the anxiety and uncertainty of being told you need to have a whole lung removed, and
Yeah.
then the recovery process, and adjusting to life with only one lung. These are all things we have to think about
Yeah.
when we consider the patient's overall well-being.
It's a good reminder that behind every medical chart, behind every scar, there's a person with their own unique experiences and struggles.
Well said. Empathy and understanding are so important in medicine.
Okay, we've talked about a lot of possibilities based on these scars, but there's one thing in the notes that we haven't talked about yet. Something that could tell us about the patient's current health and what might happen to them because of their lung condition.
Oh.
I'm curious.
We'll talk about that final clue when we come back for the last part of this deep dive.
Hmm.
All right, so we're back for the final part of this deep dive, and expert speaker, are you ready for that last clue?
Absolutely. Tell me what else the student found in those notes.
Okay, so remember how we talked about looking for signs of cancer coming back after surgery? Yeah, like losing weight for no reason, being tired all the time, or changes in their breathing.
Right, and the student mentioned something called cachexia.
Cachexia. That's different than just losing weight, right?
Yeah, it's more complicated than that. It's like this whole body thing where you lose muscle and body fat. It can be a sign of a serious illness, especially with some cancers.
So the student mentioning it makes it sound like they were worried about what might happen to the patient.
Yeah, it makes you think, but the notes don't actually say if the patient had any signs of cachexia during the exam. But just the fact that the student wrote it down tells you a lot about how they were thinking about the case.
It shows they were really thinking it through, not just focusing on what they saw right then, but thinking about what could happen down the road. That's a sign of a good doctor.
It really is. They were connecting the dots, thinking about the possibility of advanced disease, even if the patient didn't have clear symptoms.
Yeah, like a detective trying to predict the next move.
Trying to stay ahead of the game to give the best care.
Exactly.
It's amazing how much we've learned from just these notes. We started with some scars, and now we've talked about all sorts of complicated medical conditions and surgeries and how doctors figure things out.
The body can tell you so much if you know how to listen.
And those scars are like a map of the patient's journey through the healthcare system.
A journey that probably had a lot of tough times.
Yeah, both physically and emotionally. I can only imagine what it must have been like to be told you need a whole lung removed.
It reminds you that every patient has a story.
A story that goes way beyond the medical records and those scars.
And that's something we should all remember.
Exactly. So, listener, the next time you see someone with a scar, remember that it could be a sign of so much more than just a physical injury. It could be a sign of resilience, of the amazing ability of the body to heal, but it could also be a sign of hardship, of really tough choices, and the emotional impact of illness. It's a story worth listening to, a story that reminds us that medicine is about people.
Well said.
And with that, I think we've reached the end of our deep dive. I hope you've enjoyed joining us on this journey of medical discovery. Keep asking questions, keep learning, and keep exploring the hidden stories all around you. That's all for today.